Hey everyone, this is Avery. Today I will be going over eczema, also known as atopic dermatitis. Throughout this presentation, I will be reviewing the etiology and pathophysiology, the signs and symptoms of this condition, the diagnostic criteria, and pharmacologic as well as non-pharmacologic treatment options. Eczema occurs when a dysfunction in the skin barrier inhibits the ability for the skin to become adequately hydrated. There is no single cause of eczema. Many factors contribute to it, including both genetic and environmental factors. One main developmental cause includes a defect in the skin stratum corneum. The stratum corneum is the outer layer of the epidermis. It functions to maintain the body's water retention. A defect in the stratum corneum causes a decrease in lipids, such as ceramides, that work to prevent this water loss. This causes a decreased ability to maintain the skin's protective barrier. Eczema is also associated with what is called the atopic triad. This triad includes atopic dermatitis, allergic rhinitis, and asthma. Eczema is a chronic condition. Its hallmark symptoms include diffuse, dry, pruritic skin that often leads to a scratch-itch cycle. This can cause, over time, thickening and scaling of the skin. Acute flare-ups include erythematous patches and papules, as well as vesicles in more severe cases. Upon physical exam, eczematous rashes most commonly appear on the flexor surfaces of both the arms and legs. Eczema is a clinical diagnosis. It is primarily influenced by the American Academy of Dermatology diagnostic criteria. This criteria is broken down into two subcategories. These categories are both required criteria and important criteria. Required criteria for eczema include pruritus, age-specific patterns, typical presentation, and chronic eczema with relapsing history. The important criteria for an eczema diagnosis include early age onset, personal history of eczema, family history of eczema, personal or family history of other atopic diseases, xerosis, also known as dry skin, and IgE reactivity. Labs and imaging are not typically required for the diagnosis of atopic dermatitis. The only instance in which further examination may be indicated is if the patient is refractory to treatment or if the practitioner is trying to rule out certain differentials. Now we are going to go over the treatment options for eczema, also known as atopic dermatitis. We will first start with non-pharmacologic treatments. While eczema cannot be completely cured, there are many lifestyle modifications that can be implemented to reduce the severity of the condition. One modification is avoiding hot showers. Hot water is known to irritate and dry out the skin. As previously discussed, this condition is defined by a dysfunction in the skin barrier, so any additional drying and irritation can worsen the symptoms of eczema. Another vital aspect of managing eczema includes the daily use of an emollient. Emollients work to lock in moisture and prevent water loss. This is why it is best utilized after a shower or a bath. Different types of emollients include creams, lotions, and ointments. You can use these after pat drying your skin after a shower. Lastly, the most important non-pharmacologic treatment for eczema, as well as the best prevention for skin aging, is the daily use of sunscreen. Now we will be discussing pharmacological treatment. Most people use some type of medical management to keep their eczema under control, along with the lifestyle modifications that were previously discussed. The first-line pharmacological treatment for eczema is a topical corticosteroid. This works by reducing the response of skin cells in inflammatory conditions. Depending on the severity of eczema, topical corticosteroids can be utilized for just acute flare-ups or for both acute flare-ups as well as chronic maintenance. During an acute flare-up, topical corticosteroids are often used twice daily. The potency of this treatment is dependent on both the severity of the eczema flare-up as well as the location of the flare-up on the body. High-dose topical corticosteroids cannot be used for long-term maintenance treatment. Maintenance treatment utilizes a lower dose topical corticosteroid to work to reduce the amount and the severity of the flare-ups. However, research suggests that a lower maintenance dose regimen combined with the higher maintenance dose for acute flare-ups has a higher efficacy rate than acute treatment alone. To recap this presentation, eczema, also known as atopic dermatitis, is an inflammatory skin condition influenced by both genetic and environmental factors. This condition causes a disruption in the skin barrier and decreases the water retention. The clinical manifestations of eczema include pruritus, xerosis, and erythematous patches primarily on the flexor surfaces. Eczema or atopic dermatitis is a clinical diagnosis. Treatment can include both pharmacological and non-pharmacological treatment. Here is my reference slide, and thank you so much for watching this presentation. I hope that it was helpful and that you learned a lot. Thank you.